We at Hosmat Hospital care for all patients and that each person is unique and treat them with care, love and dignity. We believe that each patient is an individual, a member of a family and member of the community, and that each patient deserves physical, emotional, psychological and spiritual support regardless of race, religion, caste, creed or economic status. Our motto is Hosmat Hospital, medical excellence with a human touch.
Hospital for Orthopedics, Sports Medicine, Arthritis, Accident Trauma, Hosmat, is one of the first super major specialty hospitals that was set up in the country. And now with the Hosmat Arthritis and Joint Replacement Center, Hosmat Institute of Neurosciences and Hosmat Institute of Spine Problems, it becomes the first comprehensive hospital in India specializing in orthopedics, sports medicine, arthritis, accident trauma and neurosciences. Hosmat is undergoing an expansion phase, making it the largest specialty hospital of its kind in Asia.
Chandy being the director and the chairman of the hospital. He heads the Department of Orthopedics and Total Joint Replacement Unit, and he is actively involved in screening of the patients, performing surgeries on the patients, and then providing a post-operative care. And in his team are we three total joint replacement surgeons, I being Dr. B.L. Prakash, senior joint replacement surgeons, and two of my colleagues, Dr. Narayan and Dr. Praveen. We are running a fellowship program for doctors to train them exclusively in total joint replacement surgeries. And the results of the joint replacement surgeries performed in our hospitals are in par with any other centers in the world as far as the outcome of the total joint replacement surgeries are concerned. Dr. Thomas Chandy, senior orthopedic surgeon, joint replacement consultant and sports medicine specialist. It's a pleasure to work with him, and he is being a senior orthopedic consultant, medical director. He guides the working force here with enthusiasm, and it's pleasure indeed to work with him and as a team.
Hosmat Hospital is one of the largest centers which is dedicated only to orthopedic and spine surgery. On a daily basis, we do 2 to 3 cases of severe complex spine surgeries. In addition to this, almost around 60 to 70 surgeries are done a month. This hospital is unique in the fact that we have an excellent teamwork and a team comprising of both orthopedic surgeons and neurosurgeons. The orthopedic team is led by Dr. Thomas Chandy, senior orthopedic surgeon, who is one of the senior most surgeons in Bangalore. The neurosurgeons are 2 in number. Together we perform a wide range of surgeries, and the patient is also mutually benefited because of the cooperation between the 2 surgical departments.
We get patients who have broken their jaw, full faces that are not recognized, and we send them back after 7 days with all the surgeries done and other associated fractures which have been with the orthopedic surgeons or associated with the neurosurgical problems. We started this implant and facial aesthetic center 3 years back. but the response has been extremely good. Patients are quite aware that we are doing a lot of orthognathic cases, we are doing implant cases. We have done in and around more than 2,000 cases of implants in the center for 3 years. We have patients walking into a hospital from different parts of the world, like UK, US, Canada, etc. This implant center has been one of the kind. And a first center which has opened in Bangalore, where we treat exclusively oral implantology. It has been an idea from Dr. Chandy and myself when we sat together and said that we should open one of this kind.
We at Hosmat strive hard to give all our patients with a good functional hand. We treat the whole gamut of conditions affecting the hand, like hand injuries, wrist injuries, peripheral nerve injuries, conditions which need tendon transfers, and congenital defects affecting the hand. We deal most commonly with hand injuries due to road traffic accidents, industrial injuries, and crush injuries due to various other causes.
Joint replacement surgery was previously done most commonly in the old people. The common perception was that joint replacement surgery is only for the old people who have suffered from arthritis for so many years. I know we have done the joint replacements even as young as in a 15-year-old boy. The purpose of the joint replacement is pain relief. When we have no other solution, I think the age is no bar to have the joint replacement.
This is a special equipment used in the operation theatre. This machine behind me and this eyepiece is called a surgical microscope, a sophisticated surgical microscope. This is used for doing microsurgery, where the surgeon looks through an eyepiece and the image is very much magnified, and you can see the one or two assistants can also see through that. And the surgeon can either look through this or can look directly on the screen and do the operation. I was 21 years when I wrote the song. I'm 22 now, but I won't be for long. Time's running out, and the leaves that are green turn to brown, and they wither in the wind, and they crumble in your hand. I watched a pebble in the brook, and watched the ripples fade away, and it never made a sound, and the leaves that are green turn to brown.